Today, Ministry of Health officials met with the team over at the Carlton Memorial Hospital to chart the way forward for the healthcare service provider on the heels of the crisis. An initial assessment by engineers from the Ministries of Works and Health, the Pan American Health Organization, as well as the Hospital Authority, confirms that debris is falling from the ceiling and columns have been compromised. This has placed the hospital into an emergency mode, functioning at only 50%. A short-term fix has been put in place as Mexican engineers will be brought in to further assess the structure, which was built 20 years ago in 1994.
We were alerted of a situation at K.H.M.H last week Wednesday afternoon. Upon being alerted, I think we had one of our engineers from NEMC, and we had asked an engineer who is attached at PAHO to go out a preliminary assessment in Belize City. Minister Marin went, he was already in Belize City, he accompanied that initial assessment, and I believe K.H.M.H had their own engineer that was doing their own assessment, and they started with remedial actions on that same Wednesday. Subsequent to that, I believe we have had Ministry of Work engineers do some assessment, and I know we had a verbal report from one of the engineers from a private company. All three reports that we have received in writing are giving due course of action that needs to be taken in the short term, quick fixes, middle term, medium term, and long term of what needs to happen at K.H.M.H.
What is the immediate fix that they gave to you?
Well, one of that was reinforcement of the beam, which is the one that seems to have fractured. And then, of course, one of the other recommendations is that there needs to be an in-depth assessment of not just whatever was falling, but the entire structure. And that's when we were alerted of that from last week. Thursday, Friday, we had tried getting some assistance through the PAHO country office and also with our counterparts in Quintana Roo.
On Monday, the K.H.M.H confirmed that the damage to the roof, believed to have been compounded with the January earthquake that had triggered a tsunami threat to Belize, is affecting the operating theater, central sterilization unit, imaging department, specialist clinics, pharmacy, and dietary service. And even as a medium and long-term plan is being established, the ministry is trying to ensure that elective surgeries and clinical services resume. Director of Health Services, Dr. Marvin Manzanero, explains the options available.
Yesterday, the Central Health Region Manager met with Dr. Koi to try to see how we will address, again, quick fixes. For example, specialist clinic, we are suggesting maybe that those can be delivered from the other health clinics in Belize City. We were considering opening hours beyond the 12-hour that we are doing, probably going up to 10 the night, opening on Saturday, on Sunday, to try to alleviate some of the flow of patients that go to K.H.M.H. I don't know that any of the engineering reports had actually suggested that all these areas would be non-usable. I think that they said while we are working on some areas, we can cordon off portions of the hospital, and the other portion should be fine to be able to work with. As options, we have made it known to Dr. Koi that even in terms of elective surgeries, an option could be go to Western Regional, go to Northern Regional, where we have operating theaters. If we feel that there is not going to be an option to use those operating theaters in Belize City. So those are options that are being placed on the table from our end, because we need to be able to be prepared for whenever the full report is done. CEO Figueroa is this morning in Belize City. He's at K.H.M.H trying to discuss further ways forward in terms of trying to ensure that we are not stopping the flow of health services.
In terms of accident and emergency, the National Referral Hospital is still operational. Dr. Manzanero says that the public will need to assist.
A&E has not been closed. I mean, that has continued. I think the differentiation that we're trying to make is try to ensure that people who go to A&E are real A&E cases, as opposed to people who may very well be able to be seen in the outpatient department. I do know that last week, Thursday, Friday, what had been suspended was elective surgeries, and that's understood, and outpatient clinics. We are trying to work with K.H.M.H to get those up and going. So if those services are eventually being given from some other facility, then that's where it's going to be.
A digitized copy of the building plan has been forwarded to Mexican engineers who are to arrive in country later this week. Duane Moody for News 5.